The referral happened very quickly, and when we got to the memory clinic, the staff were very friendly, very kind and supportive, and he did receive the diagnosis very quickly.
I asked the doctor, I said, oh, am I going to pop me clogs or what? He says, no, we can treat it. So he said, stop worrying, we'll do it for you. I said, right, that's it.
There's a great comparison in the hospitals between Lancaster and York General Hospital. The attention there was very, very good. The food I thought was excellent. Having lost a stone in Lancaster, and I was hopefully getting built up, but I was only there a few days, so I had to come home and get built up at home.
Everything seemed to be going fantastically well. I was being given proper treatment, I was being listened to, I was being taught how to deal with things.
The fact that I've had the same breast care nurse right the way from day one, the very first appointment, even though it's been different treatments, has been brilliant, because I know that I can ask her any questions and, you know, and she asks me things.
I've been in and out quite a bit in the last 4 years. Every time I've been in, I've been treated with respect and well looked after.
My mum's not very well to start with, and she was in the waiting room when they decided to do all her observations in the waiting room with other patients around as well.
Having hemorrhaged in the night, I had to call the night duty doctor from Kendal Hospital, and sadly I was taken to Lancaster, which was a disappointment, but I wasn't aware that I could ask to go elsewhere.
I was undergoing cognitive behavioural therapy at CAMHS in Hounslow when I was told that because of my age I now had to make the transition into adult services. I was then told that my treatment would be stopped and I would have to wait up to a year to receive any more treatment from adult mental health services.
And left the memory clinic that day after our appointment with some leaflets in hand. And from that point on, we were sort of on our own really, and it was up to us to kind of look for and fight for the help that Dad needs.
They left her in a cubicle, sat on a chair, bent forward asleep. On next to her was a packet of antibiotics. They should not have been there. My mum has dementia. She could have opened the packet, taken some tablets, put them back, and she could have got them again and taken them again.
I think it's essential that the patients have good food. Otherwise, you know, that aspect of the caring and building up isn't happening.
Less waiting time in the waiting rooms. It does not help the patient at all when they are not well to start with and they get irritable and stressed and restless.
19 is a very vulnerable age, especially to be left alone, to be made to feel completely abandoned by the people who are supposed to be there to help you. If I had cancer or some other terrible physical illness, then there would be no way that I would be told that I'm not going to receive any treatment for 6 months to a year.
The convenience of a very local hospital is what is important to us. At the end of the day, he's still trying to work as well, full time, as well as taking me for the appointments. Half of your day's gone just by travelling down to Preston, then the treatment, and then travelling back.
With Alzheimer's, you don't always need the help with the physical tasks. It might be because you're experiencing distress, so you need reorientation, reassurance, but apparently you can't get care for those kind of needs. It's all about practical help with physical needs. So that's definitely something that I would change, and that care should be provided what you need it for, not just for physical health needs.